I want to say hello to Mohammed Adem Malin, that's joining from Ethiopia. Warm welcome to you. It's 5 p.m. in Geneva, and I just want to say hello and warm welcome once again to everyone that has joined us today for our first experience sharing session for the week. This is part of the full learning cycle of the Movement for Immunization Agenda 2030 that started on the 7th of March 2022 with a two-week ideas and practice generation using the ideas engine, followed by 4 weeks of situation analysis, 2 weeks hackathon for IA2030 action planning, and currently we are finishing up with the Impact Accelerator launch pad. So before I move forward, I just want to remind you that on the 17th of June, we are going to be holding our quarterly networking event, Teach to Reach Connect. And if you have not yet requested for your invitation, please go ahead and do so. Go to learning.foundation/teach to reach and request for your invitation, as well as share to all the health professionals in your network, because this time around, Teach to Reach is not only for immunization professionals, it's open to all health professionals, and it's a date that you should not miss. So as I was saying earlier, we are here. This is week 3 of the Impact Accelerator Launchpad. And as you know, for you to participate actively in the Impact Accelerator, there are 2 things you need to do every week. Every Monday, you should set the goal, the action that you want to complete by Friday. And if you have not yet done so for this week, please go ahead and click on the link that I'm sharing with you right now on the chat and take less than 2 minutes to set your action for this week. Also, on Friday, we are going to be coming back to you to tell us how your week went, and you'll be requested at that time to share your experience with us. So when the time comes, you're going to receive the link by mail asking you to tell us how your week went. We'll be asking you to share your experience, your lessons learned, your success stories, the challenges that you face, but most especially the outcome and what you are doing to take you towards the implementation or the goal that you set for that you want to achieve by the 17th of June. That is the end of the Impact Accelerator Launchpad. But most of all, as I said earlier, this session is all about experience sharing. So we'll be turning towards you to tell us how you are doing. What did you plan for the week? What did you do last week? Were you able to meet up with the action that you set for yourself last week? What a success story, what lessons learned, what challenges did you face? How can you share those with us? And what have you planned for this week? And how will that help you to achieve your goal, the goal that you set for yourself by the 17th of June? So get ready to raise your hand to share your experience with us. And of course, as always, we have with us Dr. François Gasse, who is our guide on the side. Good evening, François, and warm welcome to you.
Hello, Charlotte, and welcome to all those one today on the call, and looking forward to hear of your experience. And I think the big benefit is to have the shared experience. It means that all the people participants should share with their own experience in the similar situation, or bring up their own ideas to the person sharing that could help the one realizing corrective measure and his plan of action can benefit. So over to you, and looking forward to listen. Thank you, Charlotte.
Thank you so much, François. And so we have a raised hand. We have Melese Teferi, whose hand is raised. Melese, please go ahead and unmute yourself and share your experience, but do not forget to remind us, for the sake of those who are joining for the first time, who you are and where you're connecting from.
Thank you, Charlotte. Thank you, François. I'm really happy to join you for this interesting session. I'm Melese from Ethiopia, working in Armar Cancer Research Institute as a researcher. And also I'm co-investigator for effectiveness study of currently used vaccines for COVID. This is a national trial actually that is conducted currently that try to measure the effectiveness of the vaccine in our community. So I'm one of responsible body just involved in research activities. Yeah, I'm also actually have lots of experience in previous experience in a health center and district level immunization activities. So I'm happy to just join you. What is your goal for June 70? This is actually stated before. My goal is to have a well-organized plan and joint or aggregated activities that is accepted by my stakeholders, and have full of resources that ready for active implementation. So I'm just working to address relevant stakeholders and going to develop together or finding resources even if additional resource also available. We just asking for local implementers, non-governmental organizations, and governmental organizations, and also private health institutes also asked to just to work with us and try to find different resources that maybe help to our implementation activities. So this is my goal for June 17. For this week, I already plan to just meet my stakeholders for tomorrow afternoon to have a common understanding with the action plan and really to get different insights from stakeholders, especially the funding organizations and the policymakers even, so that to just aggregate the routine immunization with the currently implemented COVID prevention control activities to use the resource that is used for COVID together with the routine immunization. So this is a really important session. Maybe I will share for Friday's meeting what will be happen and what will be the result after the meeting. And this is my this week action plan. The last week I was actually engaged with my organizational responsibilities that I couldn't go for my action plan to address my challenge for this for these immunization activities, because I was actually delegated for my organization to give training, especially for research methodologies. So for the last week, I was actually in different assignment. That is the responsibility of my organization. But for this week, I plan to just contact all stakeholders and have a common understanding and decision to go to the implementation activities.
Okay. Thank you very much, Melese. Yes, François.
Is it a research? Is it a research project, or is actually a plan to integrate COVID activities and routine using the resource allocated to COVID?
Yeah, my challenge actually address huge zero-dose children in Ethiopia. That's actually aggravated by COVID pandemics. So I need to integrate the prevention control activities that is given for COVID, and almost all resources have moved to COVID prevention and control activities, and almost many of healthcare activities are left behind and just go the health workers and health professionals just focus on COVID prevention. So using this COVID-related activities for immunization, for return immunization, by integrating these two is very important for me. So that I just going to integrate the COVID prevention activities with the return immunization activities. But last week I was working in training sessions that's I was actually assigned by my organization to give training for research methodologists, but so that I was not working for this action plan. So this is to tell that previously I was, last week I was in the other assignments.
It's a nationwide program, so.
Yeah, it is actually a nationwide program because
okay. Thank you.
Even though COVID is commonly just the prevalence is high in crowded population, especially in the towns, because transmission rates may be affected. However, there is a lot zero dose children that may be the need for immunization and really affected because of resources and even afraid of bringing their children to the kids facilities because of the COVID problems. So it is a nationwide program, and I need to use this opportunity to motivate policymakers as well as local implementers and private public health institutes, and as well as clinics and government funding organizations like UNICEF and GSI that's working in actually in Ethiopia.
Okay.
Thank you, Melese, for naming some of those stakeholders, because that was a question I wanted to ask you. And another question is, will you be meeting the stakeholders individually, or you'll meet them all grouped together?
Yeah, actually, my plan was actually to just bring together and discuss the how much the gap is huge, and how working together is very important to address these huge problems. But I don't think this may be true. So as plan B, I need to go to in different places to address contacts in different organizations. So then I'll organize even Zoom meetings so that we can have a common understanding to just share experiences from different organizations and align our resources together. Yeah, this is actually my plan. As you said, I was just plan to have a common session, just to talk together gatherings, but this actually couldn't be true. But so I need to go individually and try to just even develop or have a call with them. Yeah, this I need to have the I need to have developed different ways to just contact. Even I try to contact by email also. Also, I contact with phone calls. Yeah, this is the way that I try to contact them. But tomorrow I will have a session with them. Maybe some of them maybe will meet together. Yeah.
Okay, thank you so much, Melese Teferi. If you are in the room and you have any question to ask Melese about his implementation progress, please go ahead and raise your hand to do so. You can actually type your question or comment in the chat. Now, if you also want to share your experience, please go ahead and raise your hand. Okay, I see Dr. Ndayo Iwo, your hand is raised. Go ahead, Dr. Ndayo.
Thank you, Charlotte. Thank you, co-host, and thank everybody else. I followed through the presentation. That was a very good one, and mainly on the demand side, and having to align the services with the demand to improve uptake and coverage. So the integration, like the experience we are having now, in fact, I'm just leaving the meeting. I'm in country. The sub-national have developed micro plan, and then for integration of COVID-19 into routine immunization, so that we utilize COVID-19 vaccination in Nigeria. Sorry, I'm Dr. Ewart. I'm the chairman of Geneva Community Care Foundation and an immediate past executive secretary, Federal Capital Territory Primary Health Care Board. And so I've been on immunization programming for over 25 years and still counting because I'm still organizing that and being fully in the field. So if there is an in-country plan, policy or guidelines on the integration of COVID-19, because that is the way many countries are going now on vaccination activities and integration of primary healthcare activities in the service, particularly the people. So wherever you are operating, whether it is a community or wherever, you have to link it to the primary healthcare facility or to the health facility that community is in the catchment for data integration into the national health information system. So if that is what we are doing here. So we can now show in a larger picture how the contribution that we are doing in a small community is translating into regional and national improvement in coverage and uptake of service. So this is what I wanted to share at this time, and you are doing a great job, and God bless you. So I'll stop here for now. Go and out from my side.
Thank you very much, Dr. Ewart. I just wanted to find out from you, considering that Melese was talking about his challenge being an increase in zero-dose children because of that is as a consequence of COVID-19 on routine immunization in this country. I was wondering if in the country, in the guidelines, in the integration guidelines that are being developed in Nigeria, is there any particular strategy that is put in place, taking into consideration maybe special populations, zero-dose communities, zero-dose children, and all that is, you may have it.
Yes, thank you, Charlotte. Absolutely. In fact, special consideration, we had NCDC supporting at the subnational for development of micro plan to map underserved communities and people, the nomadic populations, mapping them and then putting them on the micro plan. So this has been ongoing, and during this micro plan for integration of service, we have included that. And remember, I mentioned something about community scorecard, where communities are made to have vital statistics that is displayed in the district head palace, and the indicators will include vital statistics on death and birth. And by so doing, the community extension worker will have to go on home visit and outreach. When you go in there, you go to the district head and then look at that scorecard that is updated monthly, and find out if there were people that were born, babies that were born at that time. You can take off those there. And again, UNICEF is supporting on risk communication and is part of this integration. And what we are doing is to activate the community managerial structure for primary health care, where community members will help to improve on the demand side and the uptake of the available services. So having said that, zero dose coming from that gap on routine immunization from effect of COVID pandemic, you may have to do extra work like mop up, like doing local immunization desk, and then having health camp. That is where you have integrated services in a mobile platform being taken to that place. So you not only present vaccination, you are also treating local common local endemic diseases at the same time. So that will boost the demand and enable you to. So a team will have people that will work on routine immunization, clinicians that will have to consult, a pharmacist or a community extension worker that will serve as a pharmacist who will now have to dispense drugs. At the end of the day, you have a one-stop service point, even on outreach arrangement at health camp. Thank you, and over for now.
Okay, thank you very much, Dr. Ndayo Ewart, for that contribution. Always very useful. Melese, I'd like to find out from you. I know yours is a plan that is really focused on on reaching zero dose children. But after listening to this experience shared from Nigeria, do you think that that is having national guidelines or integrating? I'm sure your plan could be a plan that you see integrated in the bigger national immunization strategy in Ethiopia. What's your take on that?
Yeah, thank you, Charlotte. Yeah, I'm going to just ask policymakers and immunization officers in the ministry level, so that I need to just integrate these prevention and control activities to integrate to the overall immunization programs and have integrated guidelines that help to address the immunization gaps by using resources together from different prevention activities. That, for example, resources that expense for COVID and resources expense for routine immunization may be used for to improve or to address these zero dose children and improve further immunization programs. So it is a huge interest that to just bring this issue to the policymakers and people working on strategies to develop a guideline that may be address these two.
Yeah. Okay. Thank you. Thank you so much, Melese Teferi. We have Katugwa Emmanuel. Katugwa Emmanuel, your hand is raised. Are you able to unmute yourself? Okay, over to you.
Yeah, thank you very much, Charlotte, and good evening, good afternoon, everybody. I actually want to share my own experience, if allowed to go ahead.
Okay, yes, I think before I turn back towards you, François, I just wanted to quickly ask anything to add, Melese, or we can go ahead with Emmanuel's experience.
No, thank you, Charlotte. Thank you, Melese. I have one question. You know, you're talking about integrating the resources and massive resources that have been allocated to COVID, and you want to have an integrated funding package to address both routine and COVID. What is, according to you, the biggest challenge you face for integration of activity money from COVID into the routine? Do you see any really bump that you need to overcome to have a smooth integration? We have heard about guidelines that can help, but do you see any of the major challenge why there is a risk that it may not work, the integration of a lot of money from COVID into the routine immunization? What are the barriers at high level and at local level? We have heard that in Nigeria, they got a high level commitment to integrate. Do you have secured that? Over to you, Melese.
Thank you, François. Thank you for your just constructive comments. Yeah, there is actually an immediate as well as long-term consequences and challenges. When we integrate COVID with routine immunization, there may be actually immediate problems that may be faced because we integrate together with the routine with the COVID. The frustration that is given for COVID may be translate to the routine immunization program. So we need strong mobilization activities to integrate this COVID activity with the routine activity. This is one immediate problem that maybe I expect to face. But in the huge program level, there is actually different interests. There may be actually funding interests. There may be actually political interests even that may affect the to integrate two huge resources together, because there is actually different responsibility that's given currently. There is COVID prevention that's given for some group of individuals, some group of responsible bodies, and also routine immunization is that's given for a Ministry of Health, that's for a given routine program. But so when we integrate, there may be actually different interests that may be come up to tackle, bring these two things together. So huge mobilization as well as just policy advocacy is very important to bring together. There may be actually challenges, but still it may need some time, but through time people may convince, and the program will become strong and take as a true one. I think,
Thank you, Melese.
Thank you, Pastor. Thank you.
Okay, thank you, François. Thank you, Melese. I've now turn towards you, Emmanuel Katugwa, and please do not forget to introduce yourself.
Okay, thank you, Charlotte. I am Katugwa Emmanuel. I'm an immunization officer with WHO, now reassigned to the surveillance department. Recently, I've been given a new duty station in Nigeria, Yobe State. Initially, I used to be in Adamawa State. So my challenge, the goal of my IA2030 action plan is actually to do a risk analysis in my new station, taking into consideration RI indicators and surveillance indicators in the state, and also to look at my cluster LGAs and see their risk status, all with the aim of profiling, mitigating action plans that will improve immunization in this cluster. So, yes, my goal, and that is actually my goal for June 17th. The action plan also includes implementing these mitigation plans, you know.
We can't hear you.
Is it just me? So, Katugwa Emmanuel, we can't hear you.
Hello?
Yeah, we lost you for like 10 seconds. Are you able, is your connectivity able to hold up?
Can you hear me now?
Yes, we can hear you. Please go ahead.
Okay, thank you. So I said my goal, I've told you my goal for June 17th to ensure that the risk status is in place and mitigation plans, you know, are profiled. And the action plan goes beyond June 17th, implementing some of these mitigation plans that we will have profiled by June 17th. I completed my week 2 action plan, which was to actually look at the RI data for the state and the surveillance data for the state, and impute them into the risk analysis template for both RI and surveillance. Right, it wasn't an easy task getting this data from the DHIS2 focal person and the surveillance focal person also in the state, but I was able to gather them at last. And some of the data that we looked at are the indicators that we looked at in the surveillance, the RI area, for instance. We looked at the coverage of the penta-3 We looked at the coverage of birth doses for hepatitis B. I also looked at the unimmunized children, okay, the dropout rate, and it helped me into categorizing these LGS. Yes, the zero dose, of course, was also taken into consideration. Then for the surveillance aspect, I looked at LGS that reported circulating vaccine-derived poliovirus in the last 1 year. Then I looked at measles outbreak in the last 6 months. I looked at cholera outbreak in the last 1 year. COVID-19 coverage, of course, was also put in the risk analysis table. Then I took a look at the geographical and demographic risks, and also the security status, because this is a security compromised state. Yeah, so the long and short of it is that my own cluster of LGS, I had to expand this analysis across the state, and my own cluster of LGS, out of the 17 LGS, they ranked 6, 7, and 8 out of 17 LGS. Now, my plan for this week is to discuss this risk analysis with the stakeholders at the EOC, the Emergency Operations Center, and see in collaboration with, of course, we'll make some calls to the LGS and see what mitigation plans could be suggested for this LGS to improve the indicators, routine immunization indicators in these clusters. So that is what I hope to do this week, hopefully. Thank you, and over.
Thank you very much, Katugwa Emmanuel, for coming back today to complete this picture that you started painting a few weeks back, but due to connectivity issues, we're not able to get a complete picture. Before I ask you my next question, I would just like to invite Melese. Melese, there's a question in the chat for you from Syed Mirabansha. So please, if you can take a look at the question and provide an answer in the chat, that would be great. Because of time constraints, we may not be able to get back to you. All right, so Emmanuel Katugwa, I just want to find out from you, after the risk analysis, I just want maybe some key indicators to showing your findings in terms of things like coverage for DPT1 and 3, dropout rates, maybe measles coverage, and the rates of organization of the plant outreach sessions. So if you can just give us a bit of ideas, maybe in terms of the outbreaks, maybe some key indicators that you found out after the risk analysis that could help us paint a clearer picture of the situation in your state.
Okay, thank you, Charlotte. Let's look at the Penta-3 coverage, for instance. Fair enough, the 3 clusters, it's only one of them called Bade that had a Penta-3 coverage of less than 85%, all right? The other 2, Gaidam and Brusali, had 89 and 87% respectively. Now, looking at the measles coverage, all the 3 LGA had coverages below the national target. Bade had 73, Gaidam had 84, Brusali had 73%. Now you can see that all these are below our national target of 85, and one is not surprised that a few months back we had measles outbreaks, you know, in all these LGS. So I guess looking at the unimmunized, of course, they all have unimmunized children, as seen in the analysis. And the category in which they are in category 2. Category 2, meaning good access and poor utilization. And that's why they are in this priority 6, 7, 8. Over, Charlotte.
Okay, thank you, Emmanuel. So good access, poor utilization, that means the dropout rates are pretty high. And judging from the measles coverage, that is in line as well. So there are some rates, and before I turn towards Francois, there is Syed Miraban Shah that has his hand raised. Probably you may have a question for Katugwa Emmanuel. Go ahead, Syed.
Thank you, Charlotte. This is Dr. Miraban Shah from Afghanistan, working with WHO at the country office. Thanks for the nice challenges and the analysis which you have done. That is great that you are thinking about the children, and particularly for the routine immunization and improving the MCV coverage. My questions and queries are regarding that which strategy will be best answer your questions in your analysis which you have done, and you will share this analysis with the partners at the at your level. So how you will because there is measles outbreaks, there is a routine immunization coverage, low immunization coverage of Penta, and the dropout between the Penta 1 and Penta 3, and also what is the rate between the Penta 1 and also the MCV1 coverage over there in your areas, that 3 level, that the 3 areas that you highlighted, that you want to think about that, and you will implement a strategy to reach those children who are suffering from vaccine preventable diseases in your area. And also you are thinking about the zero dose children. So it requires different strategies that we were thinking under one children will cover for Penta 1, MCV1, and also if you are going to implement MOOP up or focus districts, or also thinking about the multi-antigen acceleration campaign, or you are thinking about the campaigns, what strategy will answer your analysis and your requirement? Thank you, and our.
Okay, thank you for the question. Right, like I said, this is just the first step, having made this analysis, which will be discussed with a larger house. Hopefully there should be a meeting this week, and we're going to meet at the larger house to discuss all this. However, definitely we will need some more information when we get to the lower levels to know the best strategy that suits, you know, these LGAs and then the communities. All right, definitely we will have to go lower, you know, to the communities to see which areas are more disadvantaged. And the strategy, of course, might be to increase the outreach sessions, okay? If also they are in areas where there are security situations, we may, at the state level, support them to implement what is called the hit and run strategy, okay? Whereby a lot of mobile teams are deployed, you know, at once to those areas with the help of security agents, okay? At once they go there, immunize in those settlements, and retreat immediately. This, of course, will take over some months, okay, before we begin to see improvements. Then, of course, if the state decides to do a local immunization day in those areas, fair enough. I guess if any stakeholder is able to support us, that will also be another option for these areas. I hope I tried in answering some of your questions. I cannot give you all the answers now until we meet with the larger house, and I'm sure more ideas and will be profiled at that meeting. Over and out. Hello?
Charlotte? Have we lost Charlotte? If not, I will. Charlotte? I don't know if everybody is cut off. I can hear you very, very well.
You can hear me?
Yes.
Thank you so much, Emmanuel.
Okay.
We lost you for a while, Charlotte.
Hope you are able to hear me.
Yes.
Yeah, Emmanuel. Yeah, François, are you able to hear me?
Yes. Yeah. Yes.
Yes, we can hear you, Charlotte.
Okay. Sorry, I lost my connectivity, but I'm back now. So let me just go back to sharing my screen. There was a question in the chat from Boma that was maybe in line with your final comment, had to do with the gains from polio eradication. That are there gains from polio eradication that you are considering applying to this challenge in terms of using the traditional instructions to reach these children? That is, the children that have not been reached, the zero-dose children, or the incompletely vaccinated children.
Traditional what? Instructor?
Okay, let me just.
You mean?
Boma is here with us. So Boma, I don't know if you're able to unmute yourself so that you can ask your question to Emmanuel Katugwa directly. Over to you, Boma.
Okay, thank you, Charlotte, and good evening, everyone. Emmanuel, thank you so much for the hard work you're doing out there in Yobe State. I recognize the fact that you're in a conflict reading state, and so it will be difficult to actually reach all the children. However, we've had these gains from the polio eradication efforts, where the traditional rulers played a major role in demand creation, resolving non-compliance cases and all of that. In addition to that, you know, at the fixed post too, we can also have the team there being motivated financially so that they can find some small resource and go out for their outreaches. That's covered under the OBRs and the campaigns that are ongoing. So is there a way that you're considering using all of this to integrate with RI so that these children are eventually reached at the end of the day? Over, thank you.
Oh, okay, thank you, Madam Boma. You're talking of the traditional institutions. Yes. We already have this demand creation activity going on in the state, supported by UNICEF, okay? And in fact, about 2 weeks ago, we did some community engagement training for some of the health workers in the state, okay? Whereby we emphasized that the particular cards that the traditional institutions are supposed to be, they're supposed to be using to help track defaulters given to them. We found this as a big gap in helping the traditional rulers to track defaulters. So indeed, the traditional institutions will be involved as part of the strategies to improve coverage. And talking about motivation for the health workers, definitely. This goes a long way to boost, especially the outreaches, okay? Some stipends, like they had, the WHO has the mobile teams, okay? They had to reach mobile teams that are supported. But if we're going to recruit more people in this cluster, definitely we will also need to support them. So some stakeholders may need to be approached in the state for this support. Over and out.
Okay, thank you so much, Emmanuel Katugwa.
Charlotte, we're losing you. Charlotte?
We are a long way past the time, the 30 minutes mark of the session. I'm so sorry, François. So François, can you take over?
Yeah. Yes, thank you, Charlotte, and thank you, Emmanuel, for presenting a fascinating innovations in what you do. And I have to tell you that your innovation is looked at it at very high level meeting on making a risk analysis for the various initiatives, as you're doing for measles, polio, zero dose, looking at classifying the risk in the district and looking at overlapping high risk area. And I think what you do is an initiative that may come more and more on the table of all the partners. So congratulations for this initiative, which we are looking for the results. And I think you are really to share that experience. Of course, as Syed says, the problem become afterwards, understanding the reasons first, which area overlap. You know, you may have an overlap between zero dose and routine measles. You may have an overlap between CVDPV and low penta-3. I think looking at the reasons is going to be very helpful, and look at the reasons that sometimes may be similar. And I really appreciated the line list of possible mitigation strategy that you put forward and will need to be addressed taking into the context and the disease initiative. You may have, you have listed the eat and run, you have listed the mobile team, you have many options that I totally support your comment saying it will depend on the local situation. And I would say it's a very fascinating what you're doing. And I'm looking forward to hear more about your experience, the challenge, and your success in trying to integrate sometimes some of the interventions, the strategies, the case response to your risk may be different in different areas, but it will with the word integration that you're really putting in practice and which does not seem just to be a word today. Thank you very much, Emmanuel.
Thank you, François. That's grateful.
Charlotte is gone. I think Charlotte has connectivity issue. Usually it's a time where she lives, she had a lot of rains and it may affect the connectivity. I know we are almost at the end, but there was one raised hand. Maybe the person, I don't know who raised hand, but maybe you could take the floor, unmute yourself.
Are you able to hear me?
Just now, yes.
Okay, thank you so much. I'm having issues of connectivity, but I just wanted to say thanks to Emmanuel Katugwa for sharing. So Melese, exceptionally, your hand was raised, so exceptionally, we are going to ask you to speak. Just take 1 minute to share your thoughts, your comments before we separate.
Comments for the presentation, you mean?
Yeah, because I saw your hand was raised.
Yeah, it was actually to just reflect. He said that there is a difference between target groups of COVID and target groups of routine immunization. So how you integrate it it does not mean a problem. He said that. So I want to reflect for this question because it's really important to clarify. Yeah.
Okay.
So the age difference between the routine immunization and
yes, I understand. So you're trying to respond to the question that was asked by Dr. Meraban Shah who said the target population for COVID-19 vaccination is 15 years upwards, probably, and then for routinization, it's they're under 5 years old. So how do you reconcile? How we reconcile both target groups when you talk about integration?
Really? Yeah. This is the question.
Okay. And so you say you're going to think about it further.
Yeah. Even though there is a age difference between these two target groups, the responsible body for immunizing for children is the age that's above 18, that is adults or mothers, caregivers, or any family members that is in adult. So integrating this adults who caring their children, who bring their children to vaccine, as well as during they came to for written immunization, even we can catch up for COVID-19 immunization. So even though there is a difference between written immunization target groups and COVID-19 target groups, but the responsible body for addressing immunization at whole is the adult population, because children by itself are not going to health facility to get vaccine. So the target group is the population who just in adult group. So for just facilitating vaccine activity. So integrating these two is not somewhat a big problem in difference between.
Okay, thank you, Melese and Dr. Meraban Shah. Just to maybe repeat a little bit what Melese said, is that caregivers that bring children to the health facility, be they parents or elders, family members, are adults, and they are the target population for COVID-19 vaccination. And so each time they bring the children to the health facility, it's an opportunity for them to also receive the COVID-19 vaccine. So that's just in a few words, trying to summarize what was shared by Melese. And unfortunately, we really have to go now. So I just want to say, I want to invite you to register now for our last experience sharing session that is on Thursday. And today I would like to encourage you not only to come on Thursday for our very last experience sharing session, but also to invite others, to remind others what you have learned in today's experience sharing session and why it's important for them to join. So I just put in the registration link in the chat. And remember, we also said that if you have not yet set your action, for this week that you need to complete by Friday, please go ahead and do so. I've just put the link in the chat. So click on those two links in the chat, register for our next experience sharing session that's on Thursday at 12 o'clock Geneva time, and also set your action for the week. I'm going to turn finally towards Dr. François Gasse for our closing remarks and key takeaways for today's experience sharing session. Thanks again, everyone. Over to you, François.
No, thank you for the two presenters and the feedback given by Syed and others. I think it's always nice to hear integration in practice when people talk about integration, but don't specify exactly the action step to integrate. And I feel that what has been shared as a risk analysis and looking at where the risk for the different initiatives, including the zero dose, do overlap, looking at short-term solution, mid-term and long-term solutions seems to be great. There is options because there may be initiative-specific response, but maybe some can be integrated. And I can say that many of the stakeholders are really looking forward to more integration, including our special partner, Gavi, in such an integrated approach that could be at short-term local immunization days with several antigen, and long-term correcting the outreach execution that can serve different purpose. So I think it was a very good session and very useful, and Melese equally important to convince to put the resource that have been allocated, and we know a huge amount of resources have been allocated, and optimizing those resources by boosting routine immunization is really a way forward. And we're looking forward to the success story from Melese in his plan of action to get support for an integrated joint program between resources together and activities together. So thank you to both presenters and all the comments we received. Thank you.
Thank you, François. Thank you, everyone. Wish you a great evening, wish you a great night, wish you a great day, depending on where you're connecting from. And actually, as I said, go now to the Telegram channel, just type, how did you find today's experience sharing session? What did you learn? And try to encourage peers to join for our last and final experience sharing session on Thursday. If you have not yet registered, I'm just sharing the link again with you. Go ahead and register right now. And look forward to seeing you on Thursday, 12 o'clock Geneva time. Thank you very much, François, for always being there, our guide on the side, and for the closing remarks. Until Thursday, bye for now.
Bye-bye, Charlotte, and thank you, everyone. And bye-bye, too.
Bye-bye. Salamunu.
Bye-bye.
Bye.
Grateful to you. We are grateful to the scholar team.
Bye.
Bye.
To the scholar team.
Thank you.